Hello there, I'm Barbara, and this is my urine analysis video demonstration. Urine analysis is a group of tests that examine urine to check for a variety of health conditions, such as UTI, kidney problems, diabetes, and liver diseases, and for pregnancy tests as well. During the urine analysis, the medical assistant examines the urine for its physical and chemicals. For physical testing includes the assessments of color and appearance of the urine, which also includes odor and pH levels. And for chemical testing of urine, it's an indirect means of detecting abnormal amounts of chemicals in the body, which may indicate a pathological condition. It may also be used to detect the presence of substances that does not normally appear in the urine. And the chemical testing includes pH, which indicates the acidity of urine with the normal range between 0.0 to 14.0, which a pH rating of 7.0 is considered neutral. Also specific gravity, which measures the concentration of dissolved substances in the urine, reflecting hydration status. Also protein, which presence of a protein in the urine can signify kidney damage. Glucose, which elevated glucose levels may indicate diabetes. Ketones, presence of ketones can indicate uncontrolled diabetes, starvation, or excessive exercise. Bilirubin, elevated bilirubin levels may suggest liver problems. Urobilinogen, a breakdown product of bilirubin, abnormal levels can indicate liver dysfunction. Nitrite, presence of nitrite often indicates a bacterial urinary tract infection, which is UTI. Red blood cells can indicate bleeding in the urinary tract. And leukocytes, which are white blood cells, elevated white blood cells count may indicate infection. In this video, I'll be instructing two methods of urine specimen, which are midstream clean catch urine sample and a random urine sample as well. Before going ahead with our urine analysis and checking for the chemicals, we should go ahead and do a quality control test, which is when testing for urine with written strips. It's a quality control testing ensures for reliability of a test results by 1, determining whether the written strips are reacting properly, and 2, by confirming that the test is being properly performed and accurately interpreted. So it's basically immersing the strips inside of a distilled water for 30 minutes, which allows for ingredients of the strip to dissolve in the water. And after this reconstitution of the strips, the resulting solution is tested in the same manner as the urine specimen would. The results of the control test should be documented in a quality control log. Okay, and in case the test is not working, they will go ahead and discard this kit and then go ahead and get a new one, making sure that it's airtight and that it was in a very dry and dark place as well. Then next, I will go ahead and instruct the patient how to collect a midstream clean catch urine specimen. And this specimen is recommended for identification of the presence of UTI. In order to instruct the patient, we would go ahead and provide them the equipment, which is the sterile container for the urine specimen, and 3 wipes because it will be a female. If it was a male patient, it will be 1 antiseptic wipe. They will go ahead and expose their urinary medias by spreading your labia apart with one hand and the other hand cleaning on one side of the medias using the front to back motion in order to avoid drawing microorganisms into the clean area, and discard the used wipes. Then repeat the same thing on the other side of the urinary medias. Next, cleanse directly across the medias with the 3rd antiseptic wipes. Afterwards, they would go ahead, avoid the first little bit of urine inside of the toilet, then go ahead and fold the container half full After that, they would go ahead and finish the rest of the urination inside of the toilet. After when it's done, they will go ahead and close the lid tightly, wash their hands, and return back to the office, to the examination room, and give it back to the medical assistant in order to go to the urine analysis. Now, for a male patient, it will be the same exactly thing except the way of cleaning, right? For a male patient, I would go ahead and instruct them to extract the foreskin of the penis, cleanse the area around the medius, which is the glans penis, and the urethral opening by wiping each side of the medius. And after collecting their specimen, they will go ahead and return back to the examination room and give it back to me, MA. For random urine sample is a urine specimen that can be collected at any time, of the day, and is used for urinalysis as well. It's the most common type of urine sample, and it doesn't require any special preparation, The purpose of this random urine analysis, it's good to diagnose or screen for urinary tract infections and metabolic disorders as well. It can also help determine the cause of abnormal pain, bloody urine, or a burning sensation when urination as well. So the random specimen is performed on a freshly voided random specimen. So me as a medical assistant, I will go ahead and instruct the patient to void into a clean, dry, wide-mouthed container, and the urine is tested immediately at the medical office. So they will skip the actual part of cleaning their genital area, right? The medius of their vagina, or if it's a man, their penis area, and they would just literally just go ahead and void their urine in the container, right? So that's why it's called random, and it's basically used for it's basically done any time of the day. Pregnancy test relies on the presence of HCG, or human chorionic gonadotropin, for a positive reaction, HCG is produced by the developed fertilized egg and small amounts of secreted into the urine and blood of pregnant women. As we know, medical assistants are responsible for performing a urine pregnancy test in the medical office. Before performing the pregnancy test, medical assistants should wear gloves and first check the quality control of the kit she has in hands. After the quality control has passed the test and is up to date, she will go ahead and use the kit. In order to properly read the test, we should understand what the C and T windows mean. The T window means the control line, which if appears the line on the C window, meaning that the kit is working properly, it's up to date, meaning that the results are valid. And the T meaning is the result. So if there is a line, means that the test is positive. If there is no line, meaning that is a negative. Therefore, no HCG was detected, or there is a very low percentage of HCG found in the urine or in the blood of a pregnant woman or a possible pregnant woman. Now, to properly perform a urine test, here I'm showing that I would go ahead, open the package of the urine kit, check the expiration date. If everything's up to date, I will go ahead and place it on a flat surface, and then go ahead, open my specimen container, draw some quantity, and go ahead and deliver 3 drops onto the specific site for the drops, which it's 3 drops only. And then I would go ahead, discard the collector, close the lid of my specimen container, and wait for 3 minutes to complete in order to read the results. As we may see in this case, the test is negative. However, on the C window, we may see a line, which once again, meaning that the test results are valid, meaning that the test kit is up to date and it's working properly, and then we may trust the results because it's accurate, okay? In order to collect a urine sample for culture and growth, start to urinate, let some urine fall into the toilet, and then collect 1 over 2 ounces of the urine directly into the sterile container provided. Void the rest into the toilet. Do not allow the inside of the container to come into contact with the skin, and do not collect the urine from the toilet. The provided container is sanitized and prepared especially for your specimen. That's why it's sterile. For characterized specimens, a urine sample is taken by inserting a thin, flexible tube or catheter through the urethra into the bladder. But in this demonstration, I'll be using a thin, flexible tube inserted exactly right into the container of the specimen. The urine is collected in a sterile container at the other end of the tube. After collecting culture from urine, the specimen collected would be sent to the laboratory in order to be tested and be given the opportunity to growth and be tested for a specific type of infections or anything that they're looking for to be tested. In conclusion, urinalysis is very used by the medical assistant. That is why it's very important for us as a medical assistant to know how to instruct patients and know how to answer any sort of questions that they might have when collecting the specific type of urine specimen that they ask for the specific type of disorders or tests that might be asked from the doctor, either UTI, pregnancy test, or liver disorders, kidney problems, or anything of that sort. That's why it's very important to know how to perform those procedures and how to instruct patients. Once again, thank you so much. See you next time.